I'm going to go through that. What's the first thing? We make an incision in that bikini line. We try to keep it low, hide it in the bathing suit or the panties. It's really an extended C-section incision or a phenansteel incision, right? Next step, we elevate what we call a flap. We're dissecting tissue in that plane immediately above the rectus abdominis muscle over the fascia. We raise that flap all the way up to the rib cage or to the sternum. Next step, we fix those muscles that have spread with pregnancy. Jill, no matter how many sit-ups you do, you can strengthen the muscles, but you can't bring them back together. Big point, women say, well, I'm worried about cutting the muscles. We don't cut the muscles, we sew them back permanently. So that adhesion is there all the time. Finally, next step, pull that excess skin down. We trim the excess at that incision site. We bring the belly button out where it was sitting initially, sew it up, and there's your tummy tuck. Typically, you will have drains in a couple days, so that, again, makes it a little more of a major operation.
And Jill, you're absolutely right that it is a major operation, and being an OB, you know, my patients will come to me afterwards, and, you know, after they've got their gorgeous baby out and they have this body left over, and they'll ask me what I think about them having surgery. And sometimes if you're a young woman, 25, and depending on how your pregnancy's gone, if you've, you know, gained too much weight or things like that, and you just have this skin that's hanging there, and you have breasts that are down to the floor, and it makes you feel old, and your self-image really goes. It really, the women who have had it, it's changed their lives. So you do have to know it's major surgery going in, but if it's really affecting a woman's self-image because her body is completely changed from this pregnancy, it can be a huge, huge, you know, life-changing thing, and restoration. Yes. It's really returning your body. For a lot of women, they've had previous abdominal surgery. It may have been C-sections, it may have been something else. We remove those at the same time, so that's an added benefit. But Jill, you're so right, this is serious surgery. You know, do your homework ahead of time, ask all your questions, make sure it's a board-certified plastic surgeon who's doing an abdominoplasty. No other specialty should be doing abdominoplasty.
Asking those questions, I think, is super important, so that you go in knowing your recovery is going to take a few weeks.
And know where it's being done. Very often this is being done in an outpatient surgical facility. Make sure that facility is accredited. Make sure that surgeon does a lot of tummy tucks. Make sure he has privileges at a hospital to do that procedure.
It was interesting, though, when we polled our readers and asked them, you know, how many of you would get a tummy tuck, a mommy tuck, if cost was not an issue for you. Almost 70% of them said they would do it. Then we laid out all of the complications and the potential risks and the recovery time, and 26% of them changed their mind and answered differently. So it's something to be considered about.